الحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين وعلى آله وصحبه أجمعين. Infant Feeding 1. Professor Mahmoud Hani Sulaiman. Breastfeeding. Process of breastfeeding. Anatomy of breast. Human breast consists of nipple, areola, and soft tissue, as the figure is showing. Breast is a glandular tissue and supporting tissue. Breast tissue is composed of alveoli glands, which are small sacs made up of millions of milk-secreting cells. Their ducts open outside at nipple area. While these ducts are beneath areola, they become wider to form lactiferous sinuses where milk is stored. This system of sinuses and ducts interspersed in supporting tissue, which consists of fat and connective tissue, which determines size of breast. Thus, size of breast varies from woman to woman, depending upon amount of fat. However, anatomy remains same. Therefore, size of breast is not criteria for successful breastfeeding. A mother with a small breast is equally content to breastfeed her child successfully. Physiology of breastfeeding. Breastfeeding reflexes. Reflexes in baby. Rooting reflex, suckling reflex, and swallowing reflex. Rooting reflex. When cheek of newborn baby is touched, it turns its head toward that side and tries to find nipple to suck. This is called rooting reflex. Suckling reflex starts when areola and nipple is in mouth and nipple touches palate of baby. Problem starts only when nipple does not touch palate, as in flat nipple or retracted nipple. If baby sucks only at nipple and not areola, lactiferous sinuses which are beneath areola are not pressed or squeezed, and so child will not get enough milk. Reflexes also fail. Child is unsatisfied and will cry. So position of a child is important for successful breastfeeding. C. Swallowing reflex starts when mouth of baby is filled with milk. Reflexes in mother. Prolactin reflex and oxytocin reflex, they are initiated simultaneously when child starts sucking breast. A. Prolactin reflex, which is milk production reflex. As baby sucks, nerve endings in nipple is stimulated, which provides sensory stimulus passing to anterior pituitary gland, leading to the release of prolactin, which stimulates alveolar cells to produce milk. Thus, milk production is dependent on sucking stimulus, i.e., more the baby sucks, more milk is produced. Prolactin is not only responsible for breast milk production, but also inhibits ovulation. Thus, lactational amenorrhea is natural contraceptive method. Reflexes in mother continued. B. Oxytocin reflex, which is milk ejection reflex. Sucking by baby also induces production of oxytocin from posterior pituitary gland, which contracts myoepithelium around alveoli and helps the milk flow from breast to baby's mouth. Meanwhile, oxytocin also makes uterus contract helps in involution of uterus and controls postpartum bleeding. Factors affecting reflex. It is physical factors, psychological, social, and other factors. Physical factors: pain and tenderness in breast, sore nipple, fever. Psychological factors: anxiety, tension, depression, worries, etc. Social factors: unwanted sex, illegitimate child, unfamiliar environment, presence of strangers. Other factors: oral pills, short and hurried feeds, improper position and technique, nipple confusion by baby if pacifier or bottle is offered. Position and technique of feeding. Mother should find suitable, undisturbed place. She must position herself comfortably in sitting or lying position and must be relaxed physically and psychologically. Different positions are cradle position, football hold position, and sideline position. Then she must hold and position child in such a way that body is in line, eyes towards breast, chin should touch the breast as the figure. Lower lip is everted, tongue is under areola, mouth is wide open so that more of areola is in child's mouth, as the figure shows. Mother should ensure that it latches on properly and see that baby is not smothered by keeping her fingers in between baby's nose and her breast. Improper position and technique of feeding predisposes for sore nipple and inhibition of reflexes. Signs of good attachment as the figure. Baby's chin is close to breast. Baby's tongue is under lactiferous sinuses and nipple against palate. Baby's mouth is wide open and lower lip turned outwards. More areola is visible above baby's mouth than below it. No pain while breastfeeding. Signs of poor attachment as the figure shows. Baby sucks only at nipple. Mouth is not wide open and much of areola and thus lactiferous sinuses are outside mouth. Baby's tongue is also inside mouth and does not cup over breast tissue. Chin is away from breast. It is painful while breastfeeding. Right technique of feeding in a right position of a child is the key to the success of breastfeeding. Right technique of feeding in a right position of a child is the key to the success of breastfeeding. Mother should feed the child 10 to 15 times per day, including 3 to 4 feedings during night times. Frequent sucking by child not only stimulates milk production and milk flow, but also prevents engorgement of breast. Human milk is made for human baby and cow's milk for calf. Both cannot be equated. Composition of milk per 100 milli as the table shows. For milk is low in fat, high in lactose, high in protein, vitamin, minerals, and water. Hind milk is rich in fat and supplies more energy than for milk. Preterm milk in a mother with preterm baby is rich in protein, minerals, sodium and calcium, sodium and chloride, immunoglobulins, and lactoferrin than mature milk. And here is the composition of human milk and cow's milk. Print and use. Volume of the milk. An average woman secretes average 500 milli of milk per day. It is more during first 6 months, average 700, and after 1 year it is reduced slowly, and by about 1.5 years it will be about only 400 milli per day, and by about 2 years it will be still less. Colostrum. It is the first few cc's, 60 milliliters of milk secreted after delivery. It differs from regular milk in that it is yellowish in color, rich in proteins, vitamin A and vitamin K. Immunoglobulins IgA, also it is rich in it, and poor in fat. IgA provides local immunity to gut, thus acts as an intestinal antiseptic paint. It is anti-infective in nature also, thus it protects child against respiratory alimentary diseases and against allergic bronchitis, asthma, and eczema. So it protects child against respiratory and alimentary diseases, against allergic bronchitis, against asthma, and against eczema. It clears meconium, thus acting as a purgative. Colostrum is the first natural vaccine the child receives from mother. The public health importance is that mother thinks it is not true milk because it is yellowish in color and discards it, depriving child from the benefits. So the mother must be informed about this during antenatal period itself. Informing after delivery may be too late. Exclusive breastfeeding. This means feeding mothers milk only and no other drinks. This exclusive breastfeeding means feeding mothers milk only and no other drinks. Other drinks like honey, water, glucose, water, grape water, juice, vitamin, animal milk, powdered milk, or foods that are given by mistake to the newborns. Principles of breastfeeding. Breastfeeding to be initiated within half an hour of birth. Initiated within 1 hour of birth. Because newborn is very active during first hour of life, and so reflexes are strong. Early initiation also ensures that baby gets colostrum positively. Pre-lacteal feeds, as honey, sugar, water, etc. mentioned above, are strictly prohibited. Pre-lacteal feeds strictly prohibited because not only they introduce infection, but also they replace colostrum and interfere with sucking. Exclusive breastfeeding for first 6 months of life. We are still saying what are the principles of breastfeeding. Complementary feeding to be started from 6 months onwards only. However, breastfeeding to be continued for at least 2 years. Bottle feeding and pacifiers are strictly prohibited to avoid nipple confusion and infection. Technique of feeding, guiding the baby by keeping the fingers over breast to prevent choking and to insert more of areola in mouth of the baby. Right position and right technique of feeding is the key to the success of breastfeeding. Expression of milk. Indications. Engorgement of breast, low birth weight baby, employed mother, employed. So this is important in occupational medicine. Methods. Manual and mechanical methods. Manual expression, better from hygienic point of view. If milk has to be expressed from left breast, right hand to be used, and vice versa. Thumb should be above nipple and other four fingers below nipple. Thumb is given a rolling movement over areola as given in thumb impression in clockwise or anti-clockwise direction, or breast is pressed against chest wall but never squeezed because it will lead to cell destruction. Expressed milk collected in a clean cup can be kept for 6 hours under ordinary conditions and in refrigerator for 24 hours. It should not be boiled due to boiling destroys anti-infective factors. After removing from refrigerator, if it needs to be warmed, cup is placed in a container of warm water and shaken gently to recombine fat globules with rest of milk. It should be boiled only if mother is HIV positive. Mechanical expression. Mechanical expression is by using trumpet pump, hand breast pump, Swedish pump, by searing method, and warm bottle method. Warm bottle method. A bottle is warmed by pouring hot water into it and discarded after a few minutes. Neck of bottle is cooled and placed airtight over nipple. As bottle cools, it gently sucks nipple into bottle. The warmth stimulates oxytocin reflex and milk starts flowing and collecting in the bottle. This is a statistic about Egypt. The proportion of children under 2 who were ever breastfed by background characteristics. However, the total is about 95.5% of babies were ever breastfed in Egypt during the years 2000, 2005, 2008, and 2014. Another statistic about Egypt tells us the proportion of children aged 0 to 5 months and 4 to 5 months who were exclusively breastfed. As we see, in 2008, the percent was 53, and in 2014, the percentage was 39.7. Merits of breastfeeding. Advantage of milk to baby. Mother's milk is the most complete food available in nature because it provides all nutrients which is necessary for the baby. All nutrients are present in the definite proportions. Nature of nutrients are such that they are easily digestible and assimilable. Other than nutrients, it also contains hormones, enzymes, protective antibodies. Also contains other protective substances as leukocytes, lymphocytes, and macrophages, which fight infection, lactoferrin, which binds iron and prevents growth of those pathogens which need iron, lysozyme, which destroys pathogens, and bifidus factors, which helps Lactobacillus bifidus to grow in intestine, which in turn prevents growth of pathogens causing diarrhea. Advantage of milk to baby continued. It is bacteriologically clean, hygienic. It is obtained easily. Studies showed that it improves intelligent quotient, IQ, of a child and better visual acuity due to presence of special fatty acids. It prevents obesity in child. It prevents or postpones diabetes, cancer, and hypertension in child. Anti-infective factors protect the child against respiratory alimentary disease and allergies, eczema, and asthma. Movements of sucking helps to development of jaws, thus it promotes overall growth and development of a child. Advantage of breastfeeding to mother. Exclusive breastfeeding is a natural contraceptive method. It prevents cancer of breast. It acts as an anti-diabetogenic factor by decreasing requirement of insulin among diabetic mothers. It helps in restoration of original physique. It helps in quick and early involution of uterus and decrease postpartum bleeding. Advantage of breastfeeding both to mother and child helps in establishment of a good relation between the two. Advantages of breastfeeding to family: saves money, time, conserves energy, and decrease infant morbidity and mortality. So it is universal truth that breastfeeding, it is the best start to life. It is unique, provides umpteen number of benefits to mother-child. It is the gold standard of infant feeding. It is safe, sound, and sustainable. It is the foundation for fulfilling rights of the child. It is species specific and eco-friendly. Therefore, breastfeeding is the best feeding for the baby. Malpractices in breastfeeding. Any procedure other than scientific method of breastfeeding is considered as malpractice, as delay initiation, discarding colostrum, giving pre-lacteal feeds, scheduled feeding, stopping the feed by clock, premature delay in starting complementary feeding, offering only one breast at each time, bottle feeding, and use of pacifiers. Breast problems. First, what are the common problems? Too much milk, too little milk, flat or inverted nipple, sore nipple. Too much milk, this is either due to hyperreactivity of reflexes or due to decreased feeding on that side, resulting in breast engorgement. If not relieved, may result in mastitis and breast abscess. This can be relieved by expression of milk, we talked about it, and feeding child more frequently. Too little milk. Assessed only when mother gives history that child passes urine less than 6 to 8 times per day. If it passes urine more than 6 to 8 times per day, mother is secreting enough milk. This is called witness test. Adequacy of breastfeeding can also be assessed by recording weight. If the baby gains about 30 grams per day, about 400 gram a fortnight, or 800 gram a month, that equals breast milk is adequate. All factors inhibiting reflexes result in this. Physiological remedy is by feeding child more frequently in correct position and technique and correction of underlying causes if any is present. Psychological remedy is by giving encouragement, support, and reassurance to the mother. Too little milk, milk dried, or not enough milk, continued. If there is really too little milk, the best alternative is the milk of another healthy lactating mother. That is to say, wet nursing. Next best is humanization of cow's milk and use of galactogogues. However, breastfeeding in a correct position and technique is the best galactogogue. Flat or inverted nipple. Nipple is protractile, capable of being pulled out. If it is flat or inverted, child cannot suck. So mother must be examined during pregnancy. Since nipple is erectile tissue, it is stimulated with fingers and held between thumb and index finger, then pulled several times per day, each time for a few minutes. In due course of time, it becomes normal, the upper figures. If this is found after delivery, the following searing method should be tried. The lower figure. Cut nozzle end of a 10 milli disposable searing, introduced piston from ragged cut end side. Ask mother to apply a smooth side of searing on a nipple and gently pull out piston and wait for a minute. Nipple would then protrude into searing. Ask mother to slowly release suction and put baby to breast. Baby is able to suckle. After feeding, nipple may retract back, but doing it each time before feeding over a period of few days will help to solve the problem. Sore nipple. Improper position and technique of feeding is most common cause of sore nipple, and if continued will lead to cracked nipple, which is very painful condition. Oral thrush in baby is another cause. Feeding must start from healthy breast, and when reflex is established, baby is changed over to affected side. Frequent and short feedings in correct position promotes speedy healing. If feeding is started from affected side, pain inhibits reflex. If both sides are sore and painful, first little milk expressed out to initiate reflex, and then short and frequent feeds given in correct position. Mother must apply hind milk drop on sore nipple after each feed. This acts as a soothing agent and helps in healing. Medicated creams are avoided if baby has oral thrush. 1% gentian violet should be applied over nipple and inside baby's mouth, or calamine lotion. She must wash nipple once daily with only water and should never use soap, Dettol, spirit, which make a nipple skin dry and worsens condition. Prevention of cracked nipples or sore nipples is by feeding baby in correct position with more of areola in baby's mouth and not just nipple. وفي النهاية أقول الحمد لله رب العالمين و thank you for your good listening.